Once again, good morning. Thank you so much for being here today for the third webinar of this spring series. I am Alejandra Aguilar, Prevention Specialist at the California Partnership to End Domestic Violence, gender pronouns she, her, hers. Wearing red today to honor all of our Native American sisters who have been murdered and disappeared. We have an amazing panel of experts today. You're going to be hearing also from Katie Waters-Smith, gender pronouns she, her, hers, political organizing director at the California Work and Family Coalition. Amazing advocate, organizer, has great information for us all today. Also, Sophia Chang, she, her, hers, organizing coach, representing the Chinese Progressive Association, fabulous trainer, and also curriculum developer of our paid family leave training toolkit, which you will hear all about today. I'm so excited to help unveil a piece of that with you all today. And Jenya Cassidy, she, her, hers, director at the California Work and Family Coalition. I'm going to pass the mic over to her, who will be leading a great part of today. Jenya.
Hey, good morning, everybody. I'm really excited to see so many people who are going to be using this information. I want to just say a little bit about our statewide coalition, which a lot of the people who are going to be presenting today and who are here are part of. We're a statewide alliance and of different organizations that come together in the belief that all people should have the time, resources, and support systems to be able to care for themselves and care for their families. And this work is more important than ever, that we really look at how we're expanding the right to have this, and also that we're supporting each other in using that right. So it's great to see so many of you here that are going to be using this information and sharing it with your members and your communities. So I'm going to go a little bit next one. I think I'm going to go a little bit into what the goals are of today. One of the things that we really see is that even when we have these laws that we pass in California, unless people really have the information and they have the right to use it, the laws don't make as much of a difference. So having a lot of you here today that are helping to share this information, I think Alejandra, you can go to the oh, there. Sorry. Can you guys hear me? I think it was my internet. Okay, so to putting the advocacy into practice, the goals of this, the third training, are to use some of what you've learned so far on paid family leave. We have a toolkit that we are going to be presenting today and that will be available that is for people to use in sharing this information with their community. And it's partly kind of a screening tool of just figuring out what people are eligible for and what protections you can use and what you need. The other goal is to really connect people with resources. One of our key learnings and taking away from this is that you really don't have to be an expert to be able to help people. And everybody here who has been part of these trainings, who's connected to the coalition, has at their fingertips the kind of resources that we need just to point people in the right direction. And a lot of other times that's all it really takes to be able to use these benefits that we need right now. The other long-term goal is that we really want people to stay connected. If you took this training, if there's things that you don't remember or you need to check in on, you not only have the resources, but you're also connected to people who are subject experts, people who are experts in their community, through the coalition, through our legal groups, through additional resources that come up. So it's going to be partly just staying connected, and that's one of our goals, is to be able to follow up with people and inform people when there's new laws and new information.
And part of this goal, just wanted to make sure we share, the California Partnership to End Domestic Violence is collaborating with the California Work and Family Coalition to put on all of these webinars for you. We understand that by supporting reducing financial stress, we are also able to help reduce domestic violence throughout our state. We are happy to be a member of the Work and Family Coalition and to be supporting the coalition on these goals.
So when we're looking at our goals for today, we just wanted to really show you some of the data that we're seeing and why advocacy is so important. You know, if people don't know about paid family leave, then it's really hard to use these programs, right? And looking at this data, this is from a survey done in 2014 of California voters. You can see that there are really big disparities in who's aware of paid family leave by race, ethnicity. In general, people of color are less likely to be aware of paid family leave than white people. By income, folks who have a lower household income are less likely to know about paid family leave than people at a higher household income, and also by education level. So if people have a high school degree or less, they're much less likely to know about paid family leave than somebody with a postgraduate level of education. And so when we're thinking about this data, and then I know that there are people on this call from all sorts of different organizations, you may already have experienced this with the people that you're working with that in communities that you serve and support, that there may be low awareness. And that's something that we can all change by bringing this information and sharing this information. Next slide, please. So when we look at paid family leave use, not surprising, a lot of the communities where there's low paid family leave awareness, people are less likely to use paid family leave. We know that use varies by race, ethnicity, by primary language spoken, and by geography. It was great to see so many people from the Los Angeles area and from Fresno on the call today, because those counties actually have the lowest paid family leave usage in the state of California. So we are changing that, and you are changing that by being part of this conversation. A couple of things I want to highlight on this slide. One of them is just that caregivers are much less likely to be aware of paid family leave than new parents. I know I had this experience. Donna Benton, who's on this call from the LA Caregiver Resource Center, is a great educator on this issue. And she educated me about when I had been a caregiver for my father, and I hadn't even thought of myself in that way. And I think that's true for a lot of caregivers. They don't see themselves as being someone who might be entitled to legal rights. They just see kind of their role in their family. We also have data that show that new immigrants and workers who earn low wages are less likely to use paid family leave. And sort of on the policy level, thinking about things we'd like to change. The limited definition of family does particularly impact queer and immigrant communities because family members who they need to take care of may not be currently listed as a family member in the law. Next slide, please. So some things to keep in mind today during this training. I think if there's one takeaway, it's that you don't have to be an expert to help people. A lot of times people think that they need to become a paralegal or a lawyer in order to help people navigate these laws. And I've certainly had that experience learning about the laws myself, as it can be very overwhelming. But with the information that you know in the present time, you can help people. As I said earlier, you can particularly make a difference in communities with low paid family leave awareness. And you can also provide crucial support to help people in overcoming administrative barriers. A lot of times people underestimate just how helpful it can be to provide emotional support or sitting with somebody when they fill out their application, encouraging them to keep calling if they need to speak to someone on the phone. Things like that can really make a difference for someone who needs to apply for paid leave. If you don't know the answer to someone's question, you can always refer them to a resource. We're going to have a lot of resources that we're sharing today during this webinar, and then we'd like to put together a kind of an easier to use resource list for you all later. Those are really great tools, and it also helps you not have to remember everything from this webinar, right? Because if you have a good resource, you can refer folks to that resource. And then thinking bigger picture, as you are supporting people in taking paid family leave, like you will discover their own power and their own leadership in a way that they hadn't before, and can help connect people to our larger movement to make sure that everyone can take the time that they need to care for themselves and their families without fear of losing their job or facing economic security. So thank you all for being here today. It was really exciting just seeing everyone in the chat and how connected you all are to different communities. Just every single one of you who's here is going to make a really big difference for folks during this time. And it's all the more important during the coronavirus crisis. So thanks.
Thank you so much, Katie. We are going to pass the mic on over to EDD. While I get that set up, I see that questions are coming up. Please make sure that you have your questions on here. The toolkit is going to be free to everyone. We want to make sure and have access to it. We are currently working on having it in English and Spanish. You will learn more about that in a little bit. Let me switch on over. Katie, while you load that, just want to make sure your volume is on. Katie Morales.
Good morning, everyone.
There you are. Thanks, Katie.
Thank you, Alejandra. And thank you again for having EDD participate in these conversations. We're very happy to be here. We're very happy to be able to be available through you guys, the advocates, to be here and to be able to answer questions and kind of ease some concerns that people may have as far as getting to know the program and what the components of the program involved are. So today we're actually going to go and do kind of just a really high-level overview of the program. We're going to discuss just general eligibility criteria regarding the two programs, disability insurance and paid family leave. So let's go ahead and get started. State disability insurance is a short-term wage replacement insurance plan under EDD, Employment Development Department, for California workers. It does have two components. We are going to focus a little more effort on paid family leave. However, we do want to kind of give you an overview of disability insurance and discuss what that's about as well, so you have some information. Disability insurance pays benefits if you're unable to work your regular and customary job due to your own illness, injury, or pregnancy. This includes elective surgeries. This includes rehabilitation from alcohol and drug use. So this does cover a vast amount of disabilities, or what would be considered under disability. And paid family leave, that component pays benefits if you need time off of work to care for a seriously ill or injured family member, or if you need a bond with a new child entering the family through birth, adoption, or foster care placement. We do want to let you know that although we are, EDD is the department that administers these benefits, these paid benefits, we are not the department that provides job protections. That would be the Department of Fair Employment and Housing, or the United States Department of Labor. And so we kind of wanted to give that point of clarification. Now, SDI is 100% funded by the California worker. So unlike workers' compensation or unemployment insurance, which are provided and funded by employers, SDI funding is withheld via a state mandated payroll deduction listed as CA-SDI on the pay stub. And we also just wanted to note that we're going to be using DI and PFL for the remainder of the presentation. So let's go ahead and move forward. Before we really get into the details of DI and paid family leave, we do want to address, we know that these are unprecedented times with the novel coronavirus or COVID-19, and we do want to address some concerns. Now, we can't answer particular questions regarding the coronavirus as it pertains to unemployment insurance. However, we wanted to give you information about the EDD program, state disability insurance, as it pertains to Corona. In this particular circumstance and during the pandemic, EDD has been made available to eligible workers who are unable to work because they have or have been exposed to or are suspected of having COVID-19. It does require either certification by a medical professional or a health certificate, a local health officer, and it needs to pertain to the particular individual. Paid family leave is available to eligible workers who are unable to work because they are taking care of an ill or quarantined family member with COVID-19, which also requires either that certificate from a medical professional or a local health officer. If your circumstance falls outside of those two, you may be eligible for unemployment insurance, but to really get the eligibility criteria, we wanted to provide you the EDD's resources that address situations that may be similar to your own. The websites are listed on the slide. However, the easiest way to do it is just to go to edd.ca.gov. On the front homepage, you will see the coronavirus 2019 COVID link. You can click on that. It will give you resources regarding all of the available programs through EDD and to give you situations in which you would apply for each type of program. Now that we've responded to the COVID situation, let's get back to disability insurance and let's talk a little bit more about this program. Now, DI provides you partial wage replacement benefits, again, for your own illness, injury, pregnancy, or disability. You must be under the care of a physician who certifies to the illness, pregnancy, injury, or disability. So we know we're here to focus on paid family leave, but part of specifically for paid family leave bonding, a lot of that will include or have overlap as far as your needs with EDD through disability insurance. So if you have to take time off of work due to your pregnancy, you're unable to do your normal job functions, you may take time off of work and go ahead and be home for a standard pregnancy 4 weeks prior to your due date. However, you can extend that period with doctor certification. We do pay 60 to 70% of your wage loss. This can be supplemented through your own part-time work, so you can work for the additional time or supplement using sick or vacation balance leave credits, any that are available to you. For paid family leave, we offer for individuals who are taking time off of work to either care for a seriously ill or injured family member or to bond with a new child. This pays up to 6 weeks of benefits in a 12-month rolling period, meaning you have 6 weeks. If you apply June 1st, 2020, you'll have 6 weeks for the entire year up through May 31st of 2021, and you may begin a new period after that June 1st date of 2021. So it's 6 weeks in a 12-month rolling period. DI, on the other hand, our other program offers up to 52 weeks per claim period. We did want to note, because of Senate Bill 83, we have increased the benefits for claims beginning on or after July 1st, 2020. So it will go from up to 6 weeks of benefits to up to 8 weeks of benefits. This can be split up over a 12-month period. So as long as all of these 6 or 8 weeks, if you're after that July 1st, 2020 date, are used within that rolling 12-month period, you can access them. You can use them for part-time work or intermittently as well. There is no waiting period on paid family leave. So for DI, there is a 7-day unpaid waiting period. For paid family leave, that waiting period has been eliminated as of January 1st, 2018. And we just want to note, this is not a government assistance program. This is not a social service that's offered. A lot of people are deterred feeling that it may be a handout. It's absolutely not. This is a program that you have paid into as a California worker. If you see CASDI on your pay stub, you've paid into the program. So just like you would use a car insurance if you were in an accident, we want this program and we want you to utilize this program if there is a need for it. There are 2 types of paid family leave claims. So let's talk a little bit more specific about each of those. We do have care claims where you're caring for a seriously ill or injured family member. And we do have bonding claims where you're caring for a new child entering the family, either through birth, adoption, or foster care placement. Just to note, for foster care or adopted children, they do have to be under the age of 18 to participate in paid family leave. Paid family leave care claims are available for 6 weeks. Again, claims after July 1st, 2020 will be up to 8 weeks of benefits for you guys to be there for the moments that matter, the moments to care for your ill or injured family member. These family members include children, parents, parent-in-laws, grandparents, grandchildren, siblings, spouses, or registered domestic partners. And this is not limited to in-state California family members. You can care for any family member under those previous descriptions, whether they're out of the state or even out of the country. So you can claim benefits to care for a family member back home if it is an out-of-state family member. In order to provide care in these situations, there must be a physician or a practitioner certification on file, both for the serious illness and the need for care. The care recipient must authorize or confirm that they are requesting the care. And we also wanted to note that more than one family member can take care of an individual. So if you have an individual in your family who's seriously ill or injured who needs 24-hour care, you can have up to 3 family members file for paid family leave benefits to care for that individual in that 24-hour period. In addition to providing benefits to caretakers, we do have bonding as well. So we'll talk a little bit more about our paid family leave bonding claims. These are available sorry, we can switch to the next slide. These paid family leave bonding benefits are available to new mothers, fathers, adoptive parents, and foster parents. Their benefits allow new parents to spend time with their baby or their new child entering the family through birth, adoption, or foster benefits. Now, these benefits must be used within the first year that the child enters the family. So that's either within 1 year of the child's date of birth or 1 year of the date that they were placed into foster care or adoption. Documentation showing proof of the relationship is required. This can be a birth certificate, birth record given by the hospital at discharge, or foster and adoptive placement agreements. For bonding benefits, both parents can utilize the benefits at the same time, or they can take them separately as long as they do claim benefits within that 12-month period. So how do these programs interact? For newer expecting mothers, you can utilize both programs. For disability insurance on a standard pregnancy, as we said before, you do have the option of 4 weeks prior to the due date. And then from birth, you do have a 6 to 8 week recovery period, 6 weeks for a normal vaginal delivery or 8 weeks for a cesarean section. However, the length and duration of your disability insurance claim can extend up to 52 weeks, whether that's in the prepartum period or the antepartum period, or excuse me, postpartum period. So you can have it extended out so long as your doctor is indicating that there is a medical need to extend that. That could be complications during pregnancy or postpartum complications. And then, of course, once you have completed your state disability insurance through DI, you can transition to your bonding time through paid family leave. The EDD will generate and mail an application either electronically through your SDI online or by paper if that was your listed preference, where you will apply for the program. It does not occur automatically, the bonding benefits. You do have to apply on a one-page application for transitional bonding. Once you submit that application, you will be eligible for the same benefit amount that you received on your disability insurance claim for that 6-week period. Again, July 1st, 2020, claims beginning on that date or after will be increased to the 8 weeks. We'll talk a little bit about eligibility for the program. So if you've paid into the California SDI tax, again, it's shown as CA-SDI on your pay stub within 5 to 18 months prior to taking your leave, you're most likely eligible for benefits. Now, not all employees of California pay into the SDI program, so it is vital you check your pay stub before assuming eligibility. Citizenship and immigration do not affect your ability. We are not going to ask those questions. We're not going to ask about your immigration status or your citizenship. We're not going to request any documentation from you, and we are definitely not going to be providing any of that information to any other entity as we're not asking for it in the first place. We don't use it as a determination factor on your claim. If you have paid into the program and you have CA-SDI on your pay stubs, then please apply for the program. Benefits are not guaranteed until the claim is approved by the EDD. So if you're unsure, please apply. Let the EDD make the determination. Do not disqualify yourself. Do not think, oh, maybe there's not a chance. If you think that and you've disqualified yourself, you've done a disservice. Please allow the EDD to make that determination. We are trained and we do our best to make sure that we are paying the benefits that are available to our claimants. Employment status. So your employment status is going to, in very limited ways, affect your eligibility. Really, you don't have to be a full-time employee. You can be seasonal, part-time, or unemployed, and you may still qualify for benefits. If you're unemployed, you must either be collecting unemployment insurance or actively looking for work in order to qualify for our program. Since eligibility is determined by your employment contributions in the past 5 to 18 months, not the current wages, your employment or lack of employment will not necessarily disqualify you. And if you're self-employed, you may be eligible if you're contributing to the Disability Insurance Elective Coverage Program. If you've not yet enrolled, you can find more information on that on the EDD's website. Now, we were asked to go over the claim filing process, so I'm going to give you an overview of that. How to apply, you can do it one of two ways, either apply online or by mail. Now, filing through SDI Online is recommended. It's the fastest and easiest way to submit claims. It reduces claim errors and claims processing time. In order to file a claim, you must be registered for benefit programs online and SDI Online, and tutorials can be located at edd.ca.gov/disability. That'll give you walkthrough, step-by-step instructions in registering and submitting an application online. But if you prefer to file by mail, we also have that option available to you. through the claim for disability insurance benefits, DE 2501, or the claim for paid family leave benefits, DE 2501F. These claim forms must be completed in their entirety, meaning you're not skipping any questions. Any questions that have been left blank will usually cause delays and may even disqualify a claim if we're unable to obtain the missing information. So even if you or the individual you're assisting to complete this paperwork thinks that the question doesn't apply to their situation, please have them answer it. Just have them mark no, check the box no. That will help the claims processing examiner be able to process the claim without delay. I want to talk a little bit more about SDI Online. Again, this is the recommended way of filing. You do need to complete a one-time registration with our single sign-in portal, which is Benefit Programs Online. This not only gives you access to SDI Online, it gives you access to UI Online, or Unemployment Insurance Online. So you have a one-stop shop to apply for the claim that you would need benefits from, depending on your circumstances. You will, once you complete registration, also then enroll and register for SDI Online to create your online account. You do need computer, smartphone, or tablet access and a current email address. So to file online, please log into the Benefit Program Online, select SDI Online, complete your registration, and then begin your application. If you are filing by paper for a disability insurance claim, you want to complete Part A in its totality and then have the doctor complete Part B, the physician's certificate, in totality. Please ensure that you have a signature on your portion and the doctor's original signature on their portion, and that they've completed all questions before returning to the department. For paid family leave, which we have up on the screen, we did want to talk about the different claim types. So we have a single application for paid family leave. However, you'll use different portions of that application depending on the claim type you're filing. If you are filing a paid family leave care claim, you will need to include Part A, Page 2, Part C, and Part D. So A, 2, C, D, the statement from yourself, the claimant. You'll need the authorization from the care recipient. You'll need the statement from the care recipient and a signature. And you'll also need the doctor's portion certifying to both the serious illness or injury as well as the need for care. If you're filing for a bonding claim, you'll need to use a separate portion of this claim form, which we'll have on the next slide. Bonding claims, a properly completed form would be Part A, which is the statement of the claimant, and Part B. So the former, it was Part A, 2, C, and D. I always say A, 2, C for care, and D. And then for bonding, it's Part A and Part B for bonding. And with it, you'll need to submit supporting documentation. So again, that could be a birth certificate, a claim, the birth record that's provided to you at discharge from the hospital, or the placement records for foster care or adoption. Then we have one more type of application. And again, for paid family leave, this would be the transition. So for mothers who have filed a disability insurance claim and have collected benefits through DI, this form, which is a one-page application, very easy, will be generated and mailed either electronically if you filed on SDI Online, or to you by mail. This form you'll receive. You'll need to complete this form in order to receive the bonding benefits and transition onto a bonding claim. No supporting documentation is required for this form because the DI claim in and of itself acts as the supporting documentation for the relationship between mother and child. So what happens next? Once you've submitted a completed claim, you've ensured all of the claim questions have been answered, the signatures are present, you've mailed it in. Once the EDD receives a claim, so once we receive a claim and it is appropriately completed, all of the questions are answered, we do have a 14-day period by law to process that claim with either an approval and payment on the claim or a notice of determination indicating why the claim was not approved. So please allow at least the 14 days for your claims to be processed. You can always, if you have an SDI Online account, check the status of your claim and payment, and you can check in with that system every few days. You'll know we received your claim because we'll mail or email online the notice of computation after the claim has been received. Now, this notice of computation will give you your potential weekly benefit amount. Again, this weekly benefit amount is an estimate of what your you'll receive if your claim is approved. You'll know that your claim has either been approved or if your claim has received a notice or disqualification on it, because by mail or by email, you'll receive either an electronic benefit payment notification notifying you that the claim has been paid, or you'll receive a notice of termination, and it'll give you a specific reason why your claim was not paid, why your claim was disqualified. Now that notice of termination comes with appeal rights. So if you believe that there was an error or misinformation, or you can provide corrected or updated information to the department, you can send that notice back to the department with the updated information, and we can go ahead and make a redetermination on the claim. At that point, if your claim has then been approved, you'll receive the electronic benefit notification. From there, Bank of America will be notified that a payment has been issued, and they will go ahead and generate an EDD debit card or a check, which will be sent to you after your first benefit payment has been issued. So you have the option as the individual filing how you want to receive payment. If you choose to receive the EDD debit card, you'll have full access to payment through the Visa. So anywhere a Visa logo is accepted, you can set up your account on the EDD Bank of America webpage, which is located on the back of the card, and do a direct transfer into your personal account. It's very easy to receive payment. It'll be on the card the following business day after payment has been issued by EDD. If you choose to receive check, just please note that it's going to have additional mailing time, 5 to 7 business days to receive the check and your deposit. But again, the choice is yours. You'll just mark it on the application what your preference is. And again, we wanted to thank you guys for inviting us. PFL advocates have been a very important part of growing the knowledge exchange and growing the constituency base as far as who's using paid family leave. We're really appreciative of all their efforts in working with us and really for us in everything that they do in all of their efforts. The EDD works with the paid family leave advocacy groups to promote the paid family leave program all across California. They reach communities that are underserved, and they are a trusted resource within those communities. So they are the bridge that gaps the EDD in those communities. They allow us to be able to share information, educate California communities on the DI, the state disability insurance and paid family leave programs. We are grateful for the advocates and community leaders, and we wanted to shout them out and just know that we appreciate your efforts in partnering with us, and we're looking forward to continued partnership. If you need information on contacting the branch, it is listed here, edd.ca.gov or californiapaidfamilyleave.com. We do have information available by phone as well in English and Spanish. For DI, for paid family leave, we have it available in English, Spanish, Cantonese, Mandarin, Vietnamese, Armenian, Punjabi, and Tagalog. But we also offer services in additional languages. So if you need additional languages outside of those listed, you can just refer to the EDD website at edd.ca.gov, disability /contact SDI. We have other methods by which we can go ahead and have external or third-party agencies interpreting in any language that's requested. With that, that is the end of my presentation. And I'm going to go ahead and turn it back over to the lovely Alejandra if we want to get started on a Q&A.
Yes, we've got several questions for you. Thank you so much, Katie. So first, there's a question about the times to get in, speak with someone on EDD. Can you tell us a bit about that?
So for the DI and paid family leave programs, we do have normal business hours. So we do have a Monday to Friday, 8 to 5 to speak to a representative. However, there is the automated phone service. So it does have a lot of helpful information by following the prompts on the automated, and that's 24/7, the 800 automated services.
Thank you. In-laws, do in-laws qualify
for paid family leave? Yes,
yep.
In-laws do qualify for paid family leave. I also wanted to one of the relationships that we don't typically describe well enough, but what is written into paid family leave is something called in loco parentis. That is something that I did want to address. I know that there was an individual was or there were questions surrounding the limited definition of family. So in loco parentis is someone who has either acted as a parent in lieu of a legal paperwork or a legal custody agreement. They've acted as a parent on someone's behalf, even if there's no blood relation, or they have, in loco parentis can also be caring for someone who has acted on as a parent to you. So if you've acted on behalf of someone as a parent, or someone has acted on behalf of you as a parent in lieu of legal paperwork, that's called in loco parentis. That is covered under paid family leave as well.
How is the 70 or 60% determined?
So the 60 and 70% is dependent on a wage category. So I can provide to you the exact amounts. Let me just pull that information up. We do have on the website, it's a paid family leave calculator. It really is beneficial in allowing you to understand what wage replacement and what weekly benefit amount that you'll receive. It's the easiest way to kind of indicate what claim start date you want, and then to kind of plug in the numbers for the months that it provides. So it'll tell you what months will be in your, it'll tell you what months will be included in your base period. But generally there is a threshold. The higher the income, we're gonna have a lower replacement rate. So we're giving the 70% lower income earners. Higher income earners are going to be at that 60% threshold up to the highest weekly benefit amount for the year, the calendar year 2020. I believe that's $1,300 is the weekly benefit amount. That's where we cap. But that wage threshold, let me pull up for you right now.
Okay, thank you. If it is an out-of-the-country family member that needs care, will the documentation from the physician be acceptable if it is from the family member's primary doctor, specialist out of the country?
Yes, so we do accept it. It will be the caretaker, the care recipient, the person that you're caring for. It will need to be their doctor who's certifying. If that is an out-of-country doctor, we definitely accept those. Just know that they need to file via the paper form, the doctor certification, and they will also need to just take into consideration that there's going to be additional mailing time for that, as well as we're going to have to verify the doctor's license from that country as well. So that might require an additional few days, day or two of processing in order to verify that information. So yes, although we accept that documentation from out-of-state doctors, just know that there may be some additional waiting time. And then to go back to that income threshold, if you're between $929 and $5,741.67, so the threshold is $5,741.67, being the highest quarterly earnings in your base period. If you are at that threshold, you will get 70%. Anything more than that, so $5,741.68 in your highest quarter of earnings, will be eligible for the 60% of wage replacement.
Thank you. And questions about unemployment. What is the turnaround time for unemployment to start issuing payments due to leaving work for childcare? They've heard that payments have been delayed. Want to know a little bit more.
So unemployment insurance is a separate branch under EDD. As you all know, in these unprecedented times, they're taking an all hands on deck approach right now, meaning they are pulling every available resource, including their outreach teams, to process claims so that we're getting individuals and constituents of California the benefits that they need during this time. Because of that, there isn't an available person to answer on unemployment insurance questions. And unfortunately, I am unable, it is out of my purview to answer unemployment insurance. However, there's information regarding unemployment insurance on the EDD webpage through those COVID resources. So if you click on the edd.ca.gov, click on the homepage where it says COVID-19, they do have information regarding the increased timeframes. They have information regarding who's eligible for benefits, what the criteria is through unemployment insurance. I do highly recommend that you make use of that page. It is updated as often as information changes. It is updated with the most recent information, timelines, including when you can apply, things like that, are all included for unemployment insurance. So I highly recommend that, unfortunately, in lieu of my availability to give you information, that you check out that resource.
So Katie, just want to follow up to that question is, they're saying that they have tried calling but there's no response. So any final comments for those who are not getting through, who are not getting answers?
You have the option of using the Ask EDD. So at the bottom of the edd.ca.gov page, there's an Ask EDD link. There's a new line that has been set up for UI as well. The information is available. So to get you registered online, the best way to actually contact UI right now is to register through UI online. Even if you filed by paper, by phone, or by fax through UI, you can register your account on UI online. You can see the status of your account, and there's a Contact Us tab on UI online that you can use to send a direct message to a claims processing office. Just understand that right now their turnaround time for response is about 5 to 7 days. Again, all of this information is available on the COVID website. They'll give you the alternative numbers for assistance with registering online, walking you through that, as well as walking you through the process of sending an electronic message.
Thank you so much, Katie. Thank you for your time. Thank you for all of the answers to the questions. You have access to them as well. If you are sticking around, thank you. Keep an eye out on those questions and answer section. And then there's also some in the chat. And we look forward to seeing you on the Spanish one at 1 p.m.
Yes.
So
Thank you, Alejandra.
Yeah. Thank you so much. We are going to move along to talk about family leave laws, job protection, and wage replacement.
Yes. So everybody who was in the last couple of trainings, this is review, and I do want to touch on it fairly quickly, because part of this training is, you know, the whole idea that if you knowing about the basics is really all you need. You don't have to memorize it all or be an expert, just to be able to kind of point people in the right direction. And what Katie Morales from the EDD just said is so key, that we're, as people who are out in the communities that we work in, sharing this information, that is really helping the EDD a lot to get this information out to people. So just for review, with family leave laws, there's two basic types of laws, job protection and wage replacement. And right now, Katie just went over two major wage replacement laws in California, benefits, SDI and paid family leave. And I'm gonna focus on job protection. You can go to the next slide. So job protected time off work, the ones I'm going to focus on are the Family Medical Leave Act, which we learned about in the last couple of trainings, the California Family Rights Act, New Parent Leave Act, which is for parents to take bonding leave, and pregnancy disability leave. These are the 4 California laws that I'll mainly focus on. The other ones listed here, the ADA, Americans with Disabilities Act, and Fair Employment and Housing Act, are also really important in terms of fighting discrimination in the workplace and having the right to accommodations in the workplace, so that you can also, they're also job protection in that way. But I'm focusing on the first 4 that these trainings are mostly focusing on. Next slide. So wage replacement, we really did just hear about paid leave and disability insurance, which are really, you know, California is one of the handful of states right now that have these, and we're really lucky to have them. They're great benefits. Paid sick days is a law in California that you have a minimum of up to 3 paid sick days, and in some cities you have more. Those are when your employer pays for the paid sick days. And as I'm going to talk about in a minute, there are some expansions, and we're also working on more expansions for that, since during COVID-19, we just need a lot more of that protection. Next slide. So COVID-19, as many of you are probably aware, we already have a pretty complicated network of laws in California. COVID-19 protections that just passed at the federal level add a couple of things for people who, for really very specific situations right now, need time off. And one of the first packages that passed is the Family First Coronavirus Response Act. And it has 2 major parts in it. One is Emergency Paid Sick Leave Act and the Emergency Family Medical Leave Act. You can go to the next slide and I'll describe a little bit more. So with the Emergency Paid Sick Leave Act, it increases your access of paid sick leave at 100% wage replacement, but it's very specific. So it's for an employee who is under quarantine themselves or in isolation from a government entity because of either being exposed or having symptoms, or you've been advised to self-quarantine. Well, actually, it can be following the health directive of sheltering in place or being in self-quarantine by a healthcare provider. So this is the part of this law that would give you 100% wage replacement for up to 2 weeks, and that's maxes out at $511 per day and over $5,000 over the whole period of time that you were sick. Next slide. Then the second part of this law gives you a little bit less money, only 2/3, and it really impacts a lot of people, because right now it is for people who are they're subject to an order, so they themselves can't work now because their workplace is closed due to quarantine or shelter in place, or their child's school or childcare is closed. So this is a little bit less money, and it is up to 2 weeks, but it is helping families who can't work right now because their children are out of school. And again, like in my personal opinion, this isn't enough. It's not everything we need. It's a start. And one of the things we really will talk about a little bit later today is how do we not only share what we have now, but work on maybe expanding it to what we really need. So next slide. So the other big protection is extends temporarily. So this whole law, by the way, passed in March and went into effect April 1st. It will be in effect at least up until December of this year. And we don't know exactly what will happen. There could be an extension of it. There could be new laws. Things are changing every day around these laws. So this basically expands the FMLA, our current job protection law, but to be paid up to an additional 10 weeks of leave. And it's also 2/3 of your wages when you're unable to work because of specifically the closing of school or childcare providers. So it gives you a little bit more time through the federal law to take that time off and get some additional pay. And this is paid through your employer, who is then getting a tax payment through the government. So it's kind of it's not necessarily ultimately directly from your employer, but that is where the money is coming from in the beginning. So next slide. So those are the new worker protections. And I'm going to go through this fairly quickly, but it will be on the slides that we send out. This just tells you what you need to apply specifically for that time off to care for a child whose school is closed. You would need to be able to just give your name, the dates that you need it, the qualifying reason, which would be either school or childcare closure, and then the statement that why you're unable to work, which is a lot of people if their businesses are closed or the school is closed, name of child, and then the name of the child care provider or school, and then just explaining why is there nobody else in the family or somebody else that can also take that time off. Next slide. And then the main way that we are protecting these rights, or just basically just accessing them, is we often need doctor certification. Like Katie was saying about EDD, you would certify that you need the time. You're letting your employer know if you are teleworking and now you can't work. And then if you're applying through the EDD, you would be contacting the EDD directly or applying directly. Next slide, yeah. So job protected time off, this is more kind of the heart of our different laws that we have in an ongoing way that we would like to both maybe extend for this period of time where we need more, or just in the long term. And that's the California Family Rights Act, the FMLA, and the New Parent Leave Act. Next slide, and I'll talk more about what these laws do. So these laws taken together, these laws all give you 12 weeks, up to 12 weeks of job protected time off. That's very important because even while right now, I think the key thing is people really need to get paid for the time that they cannot work. Having job protection in the long run for a lot of workers has been very important because our laws that give us money don't always protect our job when we come back. So a lot of what the coalition, the partnership, and all of our different organizations have been doing around paid leave is really trying to extend job protection to more people. So the 12 weeks of protected time off that you get under the laws I just mentioned are for these purposes. You would use it to either bond with a new child, and that's within 1 year, and that's birth, adoption, or foster. That is when the child enters your home. Starting from that time, you're bonding up to the age of 18 for in the case of adoption or foster. The other reason that you would take this job protected time off is to care for a family member who has a serious health condition. And there's a lot of different things that you'd be surprised really qualify for that. Anything with a hospital stay, a chronic condition, anything that is temporarily disabling or even long-term disabling. And then of course, for your own serious health condition, you would be able to take that job protected time off. Next slide. So the eligibility requirements are one thing that the new laws under COVID-19 do away with. And I forgot to mention that, but it's a little bit hard to be eligible for the job protection because you have to have, right now, with our regular laws, 1 year on the job, work for an employer with 50 or more employees, and for new parents with bonding, it's 20 or more. And then you've had to work part-time about 24, 25 hours a week in the year prior to when you're taking this leave. Under the new COVID-19, I think it's 30 calendar days that you would have to work. So you would qualify for some of those things without all of these requirements. But in general, when you're taking leave to bond or care, you have this slightly steep requirement. Next slide. So your rights under the job protection laws, FMLA, CFRA, and the New Parent Leave Act are basically to review 12 weeks per year. And you can take it all at once or intermittently. And the 12 weeks start, for example, in a rolling year usually. So if you had to take time off to care for somebody tomorrow, your year starts May 6th and ends the next May 6th. Job protection, you should be restored to the same or equivalent job. You should not have any kind of negative consequence for taking that leave. You shouldn't have, now they're putting you on the night shift. Not that that's always negative, but you know, they're not supposed to change your job dramatically. Benefits, you should continue any health benefits that you have. And there are extra protections for anti-discrimination or retaliation for taking that leave. Next slide. So one really key law that in California is very specific is the California Pregnancy Disability Leave. This is job protection for pregnant workers, and it is up to 4 months of job protected unpaid leave. But if you pay into SDI, as Katie mentioned earlier, you would be able to take SDI during that time. But it is for a complicated pregnancy, this is very important because you might go on bed rest, you could have complications after giving birth, and you would have that time where you wouldn't have to return to work, but you would be able to go back to your same job. Even for an uncomplicated pregnancy, because you are getting ready to give birth and recovering after birth, you would have 4 weeks before your due date and 6 weeks for 6 to 8 weeks after delivery. And during your pregnancy, if you needed to take time to go to doctor's appointments and you couldn't use a paid sick day or something like that, you would be able to, your California Pregnancy Disability Leave also protects that time. So that's California Pregnancy Disability Leave, very key. It's a really complicated time right now for pregnant workers too, and it's important to have that right. So I think I talked about some of this continuation of health benefits. Of course, can be used before and after. You do need a healthcare provider to recommend it. Usually you're being seen by a doctor. That doctor can sign certification if you need extra time. And as I said earlier, you can take SDI. It can be taken intermittently, which sometimes people are temporarily on bed rest or they need doctor's appointments throughout. And it does apply to almost all employers. You just need to have 5 or more employees. And there's no threshold of you having to work for a certain amount of time. You would be covered immediately. So that's next slide. And I think that's it for the review. And I know that's a little bit quick, but we're going to be emphasizing a lot throughout this that you don't need to be an expert. And I think Katie is going to come back in and talk a little bit about the different resources, but these resources are going to be really the most useful thing. You don't have to memorize all this, you just have to know it's there. Thank you.
Great. Thanks, Jenya, for that review. And I know we've got a number of questions in the Q&A, so we'll do our best to get that information to you all. So we've put together a couple of different resources on this slide. You'll get sent the slide application, and all of these resources are hyperlinked, so you can just click on them and take a look. Family Values at Work has put together some really helpful resources related to the new coronavirus laws, including kind of a decision tree, which I know a lot of you were asking for in the previous webinars to figure out how to navigate these different laws. Legal Aid at Work also has some great handouts and resources that I personally have used in a healthcare setting. One of the way that I got involved with the coalition was actually attending a training just like this, learning about paid leave, and then sharing that information with my patients as a lactation consultant. So all of these resources are really helpful, depending on who your population is that you're serving. You might find that one or the other is more helpful. And then the main resource that we're going to focus on now is using the Paid Family Leave Train the Trainer toolkit, which Alejandra will talk a little bit about why that resource, and why and how that resource was developed.
Thanks so much, Katie. I am so excited to share some bits about this toolkit. As we were saying at the beginning and throughout each of our webinars, this is a beautiful partnership between the California Partnership to End Domestic Violence and the California Work and Family Coalition. We understand that if we help reduce financial stress, especially during these incredibly stressful times, we are able to help support healthier relationships, healthier families throughout our state. So we work together, the two coalitions, to develop this toolkit that is currently being finished. We just saw the draft and it is looking beautiful. You are going to get access to some easy tear out pages, pages that you can print out. It's going to have all the steps for you to be able to develop, lead, facilitate a training. If you want to do a 30 or a 60-minute training on paid family leave, like we're doing here today, you can do that. If you are an advocate, a preventionist, a community organizer, and you work with folks throughout your community, you are going to get access to some of these resources that you can easily copy, print, share, distribute throughout your community, or use to help folks recognize or understand if they qualify for paid family leave and other related benefits. This toolkit is actually being worked on because we have some areas that we need to add to. For example, Katie was saying about the response during COVID. This is very prevalent and very much important to all of us right now, so we want to make sure and add that to it. It is not going to be printed right now. It is going to be available in electronic form in English and Spanish. We're hoping that within the next week or so, this is ready, and it will be available to you all for free. Yay! So while we're getting ready to talk about the next areas, if you wouldn't mind just adding in the chat, how would you use a toolkit like this? What would you do with it? How beneficial would it be? What other languages do we need to have it in? Yeah, let us know. So we're excited to share this with you all. This is just one of the pages from it. Has great information and checklists that you can use with your community members, family, friends, or if you are someone who leads trainings or community events, outreach, education, you can use these as well. And again, thank you to Sophia Chang, who helped develop the curriculum for all of this, who put all of the language together in just such a beautiful, clear, concise, easy way to access. So let's see what is going on in the chat. Yep, it's going to be really easy to carry. You can also have it available, ready to open on your laptops if you have that. Because it's going to be available online, you can open it up on your phone, you can open it up anywhere. So we just want to make sure that this is accessible to everyone. Yep.
All right, so now we're gonna show you a little bit of how you might be able to use the information from the toolkit and everything that you've learned in the webinars. Thanks so much, Alejandra, for giving some of the background. So for this piece, we have two amazing experts who are gonna be acting out how a conversation might go between somebody who's educating a friend or coworker about paid family leave. So Donna and Sophia, are you ready to go? Do you want to turn your cameras on and unmute yourself? All right. So, and then just as you're listening to this conversation, just kind of keep in mind what you're learning. The way that this role play is going to work is we're going to start the conversation, then we'll take a pause, see what we've learned, resume, and then again, take a pause. So this scene is between two restaurant workers who are on break, and one of them is pregnant. So take it away, Donna. And
how's it going, Marcia?
Not great. As you know, I am pregnant and I've been having early contractions. My doctor said I probably need to go on temporary bed rest, but I'm afraid to ask for time off, and we really need the money, especially now that my husband lost his job.
Oh, wow. You really should stay home if you can. You know, I think you can take some paid time off if you need to. Have you heard about paid family leave?
I've heard about it, but I'm not sure if I can take it.
all right, pause. So at this point, thank you, Donna and Sophia. We're going to queue up a poll question with Alejandra's assistance. And I just want you all to enter in the poll what laws that you think could help Masha take time off from work based on what you just heard from this conversation. Don't worry about getting the answer wrong, or just whatever your hunch is, enter that into the poll, and we'll give it a little bit of time so everyone can participate and then see what you all said.
It looks like everyone is seeing it, I hope. We are about 36% of you have voted. We would love to hear if we can get above 50% of you vote. That would be wonderful.
Right, and again, don't worry about whether or not your answer is correct. Just gut check what laws you think might help Masha take time off from work.
Yay, 51% has voted. Let's give it another 30 seconds. And again, like Katie said, there is no right or wrong answer. This is about all of us learning together. So if you wouldn't mind, we'll just give it another 10, 15 seconds for you to finish voting. All right, it looks like it has slowed down. Oh, 59% have voted. All right, let's close out. Oh, 60%. Look, the last person got their response in. All right, let's close it. Oh, okay. Some of you are trying to make up your mind. 62%. Okay, I'm going to close the poll. We have a couple other questions coming. So be ready, and I'm going to share the results.
All right, excellent. This is great. So you all are absolutely right. Yes, all of these laws could apply to this situation just based on what you learned in that small exchange, right? So we know that Masha is pregnant, that she is having some complications, and yes, so pregnancy disability leave, paid sick days, and state disability insurance could all be helpful laws that would help her to take some time off. So great job, everyone. Let's continue on with the role play, and then we will have some more questions at the end.
Great. So, my sister Laura just took paid family leave to care for our mother. She emailed me this kind of checklist and told me about a webinar I could watch to see if I can take paid leave and help others to take it too. Now, I know we pay into the program, and I'll share the website for the EDD, that's Employment Development Department, so you can apply. I mean, how many people do you think work here?
I mean, this is a really big restaurant. We're open 24 hours, so probably like 100 people. How much time do you think I can take after the baby is born?
Well, you can ask your doctor about taking time now if you need to before the baby is born, but it says here that you would have time to bond and heal after the baby is born too.
Where do I apply?
It's the Employment Development Department. I'll text you the link to the website. You can apply online.
This is so great, Pilar. Thank you. And I really hope your mom is feeling better and that you can see her soon.
Oh, thank you. You know, me too. I miss my family in LA, but I'm glad my sister could take time off. Well, you know, back to work.
Thank you so much, Donna and Sophia. All right, our amazing team of actors and experts. So let's queue up the next poll question, and we're just going to do the same thing here. So poll question 2 is, what do you all think? Does Masha have job protection when she goes on leave due to a complicated pregnancy? Yes, no, or not sure. And again, we're just checking in to see where what you all think. So just take a minute and respond to the poll.
All right, 39% of you have voted. For 50% of you have voted. All right, so on the last one, we got 60% participation. We have 125 participants on here today. So we would love to see that number continue growing. Again, I know I've said this before, but if we are able to show our funders that a good number of you are participating, are involved, this helps us demonstrate that this is very much needed and that folks are liking what we're doing. So, all right, 50%, 56% of you have voted. Let's see, 4 more percent. It sounds like a couple of you are finishing off your votes. 10 more seconds. All right, let me close out the poll and share the results.
Excellent. All right. So you all are absolutely correct. And it's okay not to be sure. If that's where you're at, that is great as well. So the reason why Masha would have job protection when she goes on leave due to a complicated pregnancy is because she could get a note from her doctor saying that she, is having complications and could qualify for job protection through pregnancy disability leave. So great job, everyone. All right, so then the next question is, what if she had an uncomplicated pregnancy? So could she take leave then? What do you all?
Votes are coming in quickly, yes. 30%, 35%. 40, yes, we're getting used to this poll thing now. I love it. 46%, 50. 52%. Again, let's give it another 10 seconds and we will close out the poll.
Excellent. All right. So you all are absolutely right. And this is one of the things I think that's really helpful for us to know as advocates about pregnancy disability leave, is that you can take leave for an uncomplicated pregnancy and you can also take it for a complicated pregnancy. So in this situation, right, Pilar as a friend was letting her friend Masha know about this right, and she may have only been thinking, oh, I'm going to get some time off right before I have my baby if everything's normal, and didn't realize before this conversation that she might have had the option to go out earlier. All right, so we've got 2 more questions about the scenario. The next question is, if Masha takes time before the pregnancy, can she still take paid family leave to bond with her baby? Again, based on what you learned from this conversation.
25% have voted. This is fun. I love watching the results coming in.
I just feel like what's really amazing to me about this is how much you can learn in just such a short conversation. And just one of the goals of doing these role plays is that it's to encourage you all to think about how would you actually use this out in the real world as you're talking to folks.
Yeah. All right, 54% of you have voted. We've been getting 60% of you participating on every single poll. So let's give it another 10 seconds and then I'll close it out.
Excellent. All right. So yes, you are absolutely right. So what did we learn about Masha? We learned that she's working at a restaurant and so we can pretty safely assume that she's been paying into SDI, right? And so she's going to take the pregnancy disability leave, and then she would still be able to take bonding leave afterwards. So great job, everyone. That is exactly correct. And that is, again, something that I found a lot in my work with pregnant parents, is they don't realize that they can take both leaves together. A lot of people think it's just one or the other. So last poll question, and this poll question is about job protection. Now, we didn't learn all of this information from the conversation, but based on what you learned in the conversation, and if you have these additional 2 pieces of information, that Masha's worked at the restaurant for 5 years and has worked 30 hours a week, does Masha qualify for job protection while she's on paid leave?
This also helps. So again, I'm not an expert in paid family leave. I am, like several of you, joining in to learn about this. So this is helpful in that I get to know, okay, what do I need to keep track of? Number of hours, right? Years.
And then remember what we learned about how big the restaurant is. It's a very large restaurant with lots of employees.
54% of you have voted. Again, 60% of you have been participating on every single poll. That looks great. Thank you, thank you. 57, 10 more seconds and we'll close it out.
Yay, excellent. All right, we got this. See how much you all learned? This is great. So I'm very excited. That is excellent. So, and this might even be something that Pilar might already know about Masha, how long she's worked at the restaurant, and about how many hours a week. But yes, it would be helpful to actually ask those questions as a follow-up. So that's fantastic. So what we're going to do now is do a very short version of a role play. This is a healthcare scenario. So Donna and Sophia are going to come back and and act out this role play for us. And the goal with this role play is really to show you all how you could give a very brief information about paid leave to someone in the course of your work. And so the scene is at a hospital, and a nurse walks into a patient's room and notices someone sitting next to the patient. So take it away, Donna and Sophia.
Hi, how are you? My name's Christina. I'm taking care of Elena today. What's your name?
I'm her daughter. My name is Laura. I would have been here sooner, but I only just got off work. How's my mom doing?
Uh, Very nice to meet you, Laura. Your mom's doing well. Are you the person who's going to be taking her home?
Yes.
Okay, look, I'm glad that you're here, and it's good to know that you're still working with everything that's going on.
Yeah, a lot of people I know have lost their jobs, but I work in a grocery store and I'm really lucky to still have a job, but it's been really stressful lately. I'm kind of worried about taking my mom home and how I'm going to take care of her while I'm still working.
Oh, yeah, I can imagine it's been stressful here too. Here, listen, Laura, you may already know this, but we have a program here in California for people who take time off to care for their family members. Would it be okay with you if I gave you some information about it?
You know, I've been wondering about that. It's just me taking care of her because my sister lives in Ventura. Yes, I would love some information about any programs that could help.
Oh, okay, great. Now here's a handout that's got lots of great information on it about a program we have called Paid Family Leave. And if you have any questions, you can see the website here to find out more, and you can apply online. There's a phone number that you can call if you have questions about your legal rights to take leave. And I'm so sorry I don't have more time to discuss this with you, but these are some great resources for you and anyone who needs to take time to care for a family member.
Thank you so much. This is really helpful.
Thank you so much, Donna and Sophia. So that entire conversation took about 2 minutes, half of which might have been something that a nurse might have already said if she was introducing herself to a family caregiver. So now we're gonna queue up our last poll question. So based on what you learned in this conversation, what do you think? Can Laura take paid family leave to be a caregiver for her mom?
Forty percent have voted. 48. 50. I think for me, this has also been important to understand what is a caregiver? Who is a caregiver? I think a lot of times we view ourselves as I'm a daughter, a caregiver is someone that you hire. And no, we're caregivers. If you are needing to take time off to make sure that they're okay, make sure they're taking their medication, that they're being fed, that they're walking, that they're okay, you are a caregiver. So it's important for us to talk to folks about accessing paid family leave as caregivers. 60% have voted. 5 more seconds and we'll close it out.
All right, excellent. So you all are absolutely right. Yes, Laura can take paid family leave to be a caregiver for her mom. So why how do we know that, right? We know that Laura is going to take care of her mom, right? So that's someone who's covered under paid family leave. We learned that Laura works in a grocery store, so we can assume that she's been paying into SDI because it's very unlikely she would be working for a grocery store and not doing that. And I think that this is a great example of how this conversation might play out in real life. And so my next question for you all to put in the chat is, what other questions would you ask in this scenario if you had more time with this person, Laura? What else would you want to know in order to help point her in the right direction with resources as a caregiver? Don't be shy. Any and all questions are welcome, or comments. What other questions would you ask her? That's right. So how long has she worked at the grocery store? And that's really important because that would help us to figure out, does she qualify for job protection as well? So based on this conversation, we're pretty confident she can qualify for paid family leave. What other questions might you want to know to figure out if she qualifies for job protection? Or anything else? Yep. How many employees? Yep, exactly. All right, so if folks have other questions they'd like to add in, yep, how many hours she works, how large the company she works for, how many hours a week does she work? Yes, that's exactly right. So those are exactly the questions you would want to ask to help her figure out if she qualifies for job protection. I just wanted to invite Donna and Sophia, do you have any comments about these scenarios or suggestions for how to share information with folks?
You know, I think for our end, for looking at the paid family leave, particularly for people, as you already pointed out, most of us don't think about ourselves as family caregivers because we call ourselves, you know, spouse, or we're the daughter or the adult child or maybe an in-law. So I think that for advocates, sometimes even if you're talking to someone about child leave, they may have an older relative at home that they also are caring for. And so sometimes it's when you hear someone caring for one age group, they might have someone else. So it's a good time to begin to help them self-identify by asking a question about, is there someone else that you have to care for? Because then they can be doubly stressed too.
Yes, that's very true and very common. Sophia, any comments about this or anything you'd like to add to this? No? All right, well, thank you both so much for acting these out. I wish that we were in person so we could do a round of applause. So the next two things I'll cover just very briefly. Next slide, please. I just wanted to review the paid leave checklist for paid leave and paid sick days, right? So if you had a little bit more time with someone, you could probably even just use this checklist and kind of go one by one down the steps. So the first question is, why are you using this time off? And you would take a look at why does the person that you're speaking to need leave? And then Alejandra, if you could go to the next slide, please. And then we'll look at the other questions that you would need to know. So how long have they worked there? What city do you work in is important because some cities have more paid sick days in their local ordinances than we have statewide. And then the other questions that you all added in the chat, right? How many hours have you worked there, and how many employees does your company have in a 75-mile radius? So at this point, I'm going to hand the presentation over to Sophia, who's going to speak about some best practices for sharing this information.
Great, thanks, Katie. So how do you envision yourself using these tools? I know at the beginning we did a roll call and folks shared that there's doulas, there's health workers, there's folks associated with labor unions, and individuals also on this training today. In the chat, we're asking folks to share out a few ideas. How do you see yourself sharing these tools? How do you see yourself sharing information about paid sick days and paid family leave with the families, with the individuals, with the students, with the union members that you work with?
And we know that it takes time to type into the chat, so we're going to give you a couple of seconds to do that.
Great, so Arissa is sharing, I will share with parents, families at my kids' school. I'll share with my coworkers. Someone says, I'm going to share with the moms and the families I work with at WIC. Someone says, I would love to have the toolkit available so I can see if people are eligible for these types of leave. I'm going to ask my clients more questions to see if they can use any of these programs. Very, very important, and we're going to talk about it in a little bit. Someone says, I'm going to make sure to share with undocumented folks, community members, because paid family leave and paid sick days are available to all workers regardless of immigration status. Someone also made the link between this and breastfeeding, right? Because personally, I've nursed 2 children, and so I know if you want to establish healthy breastfeeding, you need and pumping, you need to have time, right? So paid sick days and paid family leave also help buy some of that time. Great, thanks everybody. And Jenya also said, I'm going to share also with people in my local housing organization. I'm going to share at our county health center and also with LULAC clients. Someone congratulated me on nursing my 2 kids. Thank you. Someone also pointed out it's so important to make sure that this is shared with people of all genders, not just moms. Gary pointed out, really, really important. A lot of people do not see themselves as caregivers. Absolutely. And that really hit home when Alejandra shared it with me too, because I'm also a caregiver. I'm in that sandwich generation where I'm taking care of aging parents and young children. And a lot of times, if I'm not doing something that I see as super medical or something that a nurse would do, I don't see myself in that way. But actually, caregiving can include taking people to the doctor's office, interpreting for medical appointments, helping to clean and cook, all of the basic maintenance that we need to keep life going, right? Maybe we can go to the next slide. Okay, so what are some best practices for using this information? We want to consider what role do you already play in people's lives? So how are you already networked or connected to people? So I know that all the folks who are associated with labor unions, I know that we do a lot of relationship mapping all the time. So for example, identify how you reach people. For example, do you work in healthcare? Are you a community advocate? Do you work in DV prevention? Are you a union rep? Maybe you work for a nonprofit organization like a worker center. And Arissa pointed this out earlier, but we all are connected to people through friends, family members, people that we go to school with or our kids go to school with. What kind of populations, what kind of resources are suitable for the population you're working with? So for example, is a physical handout going to be more accessible? Is a website going to be the best way? Are people mostly on their phones? So an app on the phone is going to be the best way. Okay, and think about, instead of this being an add-on or something extra, think about how you can share this know your rights information in communication that you are already having with your clients, workers, friends, family. So for example, if you already do patient education, whether that's inpatient or outpatient, consider incorporating this information into the existing education that your clients are getting. If you are a teacher or a trainer, consider incorporating into a class setting, maybe with phone calls. For example, if you're a union rep and you often are talking with your members on the phone and checking in on them, incorporate this into your one-on-ones. Do you have regular meetings? You can put this information in there. You can incorporate it into brochures as well. So other considerations, what languages should the information be in? Because like Katie pointed out at the very beginning of the training, we know that non-English speakers and also immigrants and refugees, even though they qualify for these benefits, are not taking it at the same rate that they qualify for it, right? And what's the literacy level that you should work with? The EDD has a lot of information in multiple languages online, and some of our organizations also provide this information online. Check what existing resources are out there, and then see if it's appropriate or if you would want to adapt the information for the populations you're working with. Let's go to the next slide, please. How can you integrate information into existing communication? So we already went over some of this. Really important is you might want to add screening questions. So we did a little bit about this with the role plays and also social media. First Five says that they also have a kit that provides a PFL flyer. So we can share that kit with everybody. Okay, thank you, First Five. Go on to the next one, please. I'm sorry, everybody. I have a little childcare emergency here.
You can help out, Sophia.
No, oh, it's okay. I'm
No,
gonna do
you
this.
can
This is
jump in.
actually like super important, so I want to make sure that everybody gets this information. So, undocumented workers. And I know that somebody in the chat also said that for sure you want to make this information available to undocumented workers. 1 in every 10 workers in California is undocumented. So it is super important that folks understand both the rights and benefits as well as risks associated with accessing different types of benefits. So like the person from EDD said, citizenship and immigration status do not affect eligibility for state disability insurance and paid family leave. Eligibility is based on your SDI contributions. Workers have the right to paid sick days regardless of immigration status, because again, paid sick days is something that the employer directly gives, right? So you don't have to fill out an application with the government. So what's the best way to access paid family leave if you're undocumented? Fill out the paper form. So do not apply for it online, because when you apply for it online, you have to enter your social security number. In the process of applying for paid family leave, you should not use a social security number that is not actually yours. Request the paper form, and when you're filling out the paper form, leave the social security number blank. Do not fill it out if it means you're using a social security number that is not yours. Instead, attach a W-2, proactively attach a W-2 that shows the SDI deductions, right? If you have a W-2 or you have a pay stub, it's going to show SDI deductions as well as your name. So that's the best way to do it. And if you're an advocate, you're a service provider, you're a teacher, you're working with someone and helping them navigate this, make sure that you do not share with anybody else the person's immigration status if they're disclosing to you that they're undocumented. Okay, let's go to the next slide, please. So we wanted to talk a little bit about COVID-19 because it's everybody's daily reality. It's what we're all living through right now. So apart from paid family leave and paid sick days, which again are available to undocumented folks regardless of immigration status, there's also multiple mutual aid funds. So the link that we put here, when you are looking after this training, you can press on this, the hyperlink. It's just mutual aid funds for undocumented folks that Legal Aid at Work, one of the coalition partners, has collected. And also our state governor Newsom has also announced a couple weeks ago that there's going to be one-time cash payments of $500, a maximum of $1,000 per household for about 150,000 undocumented immigrants beginning in May, of which about 40,000 are going to be in LA County. And this is the information that's publicly available right now. So I'm sorry there's not a lot of detail there, but that's what's publicly available right now. Okay, independent contractors. Before we talk about what's available to independent contractors, the most important thing to understand, especially in California, is are you actually an independent contractor? You're not an independent contractor just because your boss says you are. You're not an independent contractor just because you filled out a 1099. According to the state labor commissioner, you are an independent contractor if you fulfill this ABC test, which is 3 different points. Number 1, when you're doing the work, are you free from the control and direction of the hiring entity? Okay, so the person who hired you, are they telling you exactly how you're going to be doing the work, or do you truly have freedom? Are you truly independent in the way you're doing it? Number 2, are you doing work that is essential to the business, or are you doing something different? So for example, why under California law right now are Uber drivers and Lyft drivers, rideshare drivers, they're considered employees. They're not considered independent contractors. The reason why is because all Uber and Lyft do all day is help people get their rides. So driving and giving people rides, that's essential to Uber and Lyft's business. That's why Uber and Lyft drivers right now under California law are considered employees. If you run a construction business and you happen to hire a plumber, or let's say you run a retail store, right? You sell clothes and you happen to hire a plumber. Like plumbing for your retail store, that's not something that you do all day. Like the main thing you do is selling clothes, right? So that's why a plumber would be an independent contractor in this situation. And then also, are you doing work that where you have an established business doing this independent contracting for a lot of different people? Okay, so because of this, I really want to go through this because a lot of people are actually misclassified. They think they're independent contractors, but you're actually an employee under California law. One of the most common cases is Uber and Lyft drivers. You're an employee. Okay, so you should be eligible for paid sick days and paid family leave. Paid family leave if you're paying into SDI. Let's go to the next one. Okay, if you actually are a true independent contractor, like the EDD person said at the beginning of this presentation, you can still qualify for paid family leave if you're if you're paying into the disability insurance elective coverage program. And you know, there's a bunch of hyperlinks here, but the one that I would really look at is the third one, paid leave for California freelancers. It's a really in-depth guide. It's really great. So if you know that you're working as an independent contractor long-term and you think you might want to use PFL for caregiving or for bonding, you can consider paying into this elective coverage program, so you can qualify for PFL. There's also, again, we want to talk a little bit about the COVID-19 impact. So if you're a true independent contractor, there's also certain COVID-19 benefits. So for example, there was in the Federal CARES Act that passed over a month ago, it established PUA, the Pandemic Unemployment Assistance Program, which provides for the first time some type of unemployment payments for people who are independent contractors. And right now, EDD website does have the PUA application online. It's actually the same as the normal unemployment application, but there's just extra questions to verify whether or not you're an independent contractor and what your income has been. Let's go to the next one. Workers paid in cash. Okay, so we always have a lot of questions about this. So you qualify for paid family leave if you have paid into SDI. Usually if you're paid in cash, you don't have any type of deductions usually, right? So in this case, you would not qualify for PFL, right? Because you haven't been paying into SDI. However, you do qualify for paid sick days. So California employers must provide paid sick days to you. You earn you can accrue 1 hour of paid sick time for every 30 hours you work. So that's regardless of whether your employer pays you in cash or not. So it's really, really important to keep track of your hours worked. And some common scenarios in California is a lot of housekeepers, babysitters, or nannies are working in someone's home and often paid in cash, but they actually still have a right to paid sick time. It's 1 hour for every 30 hours worked, right? So for more information, you can check out some of the links on the bottom. There are some local and national organizations devoted to working with workers who are often paid in cash, such as domestic workers and also day laborers. There's also mutual aid funds that are industry specific. So for example, for restaurant workers, domestic workers, and street vendors, and also day laborers. So given all of this training, you may still have questions, or you may still think about certain families you work with, certain clients or patients you work with who you know are going to need extra support. We know that we all have rights under the law, but we know that accessing and exercising these rights is imperfect, right? Sometimes we experience discrimination or retaliation or other type of discouragement for trying to take any type of paid leave, paid sick days or paid family leave. So if you know someone or you personally have experienced discrimination, retaliation, maybe being fired, reach out to an advocate. If they are accessing the paid sick days or paid leave, but only with certain conditions, like for example, oh, you can take your paid sick day, but you have to find a coworker to cover you, right? That's illegal. If someone's situation seems more complicated, so for example, if they have more than one job, if they seem eligible for some protections but not others. So for example, maybe you know someone who needs paid family leave, but they work super part-time, or they haven't been at their workplace for 12 months yet, right? So they could access the paid family leave, but they wouldn't qualify for job protection. All of these different factors, that person might need extra support. And I also want to lift up for retaliation. Workplace retaliation, we often think our mind often jumps to the most severe type of retaliation, which could be like laying someone off or firing someone, right? But actually retaliation takes many forms. And sometimes to remember retaliation, I think of the acronym TIPS, T-I-P-S. Retaliation at work could be threats, interrogation, promises, or surveillance. Promise is really important because it could be someone saying, you know what, you're on track to get a promotion. I would love to give you promotion, but you're going to be taking paid family leave. So retaliation could also be a proactive or some type of positive promise that you're going to get some type of positive treatment at work if you don't exercise your right. Okay, go to the next slide. So within the coalition, we have a few really great legal partners, including the Center for Work-Life Law and also Legal Aid at Work. And they provide multilingual free legal services. They have hotlines and clinics that are all being conducted remotely right now because of COVID-19. So those are some of the phone numbers right there. So an email address. And I think Katie's gonna take it away to talk about the movement for paid leave and how these laws have evolved over time.
Yeah, thanks so much, Sophia. I just want to be very brief so that we leave enough time for questions, but I did just want to share a little bit about our history and how we've gotten here. In 2002, California passed the first paid leave law in the United States, and a lot of folks on this call and involved in the coalition, including Jenya, have been involved in this work since that first law was passed. And as you know, we are finding, okay, this law is passed, and then it's implemented in 2004. What other protections do people need? And so, believe it or not, we had to pass a law to require employers to maintain insurance coverage while an employee is on pregnancy disability leave. So that's a great example of something that was expanded since this law was passed. Personally, I was involved in advocacy for SB 63. So I was able to visit legislators in person in their districts where I live in Southern California. And then I also, through the coalition and coalition partners like Breastfeed LA, where I was volunteering at the time, I was able to go up to Sacramento and participate in advocacy visits up there. And I know that all of us who did that work, that's part of why that law was passed. And that is why through new parents, they get job protection if they work for an employer with at least 20 employees. So it's just a couple other things we want to highlight. In 2018, the wage replacement increased from 55 to 60 or 70%. And in 2020, the governor actually initiated an expansion of paid leave. So paid leave will increase from 6 to 8 weeks on July 1st. Next slide, please. But even with all of that advocacy, we're still not where we want to be, right? We want universal protections for people who work and care for their family. We want the laws to be easier to understand so that people actually can take time when they need it. And one of the things that the coalition has been doing to respond to the COVID-19 crisis is we've been organizing educational visits with our state legislators so that they hear directly from their constituents what people are experiencing and what policy change we need so that we protect more people. So I would really encourage you all, if you're interested, to join us in those visits. Your story is really powerful and can drive the kind of policy change that we'd like to see. So with that, I will open it up for questions and pass it back to Alejandra so that we have plenty of time to respond to folks' questions.
Yay! What an awesome group of trainers. I just, again, if we could, I can clap, we can clap. Those of us who are able to clap, we are clapping. This is an amazing group of folks. It's been an honor and a pleasure to work with you all, to learn with you all together. So we do want to open it up to questions. Katie is here, both Katies, woohoo! Katie from EDD, Katie from Work and Family Coalition, Jenya, Sophia, Donna, everyone is here to answer your questions. So let's go to the Q&A. So again, you can add your questions into the Q&A section. I know that sometimes if we are not updated on our Zoom page, you may not have it, so you can also add it into your chat. Let's see. All right, let me go to the chat. Looks like questions have been answered. So I am going to go over and look at what we have. Yes, I'm a single mom. My 2 young daughters have been home alone for 8 weeks. I can't afford the 2/3 paid family leave. It's getting harder every day to leave them. Yes, the response is we're very sorry to hear that, and thank you for being here today. We also want to invite folks, as Katie from the coalition mentioned, to join us in visiting your state legislator to share about your story. It's important that we speak up about the barriers and the disparities that exist. And we know that at 100% of our paychecks, most of us are living paycheck to paycheck. So what happens if it's only 60 or 70%? It's even harder.
I think we just got a question from Kelly for Katie from the EDD. I don't know if, Katie, are you available to answer? How long does it take for EDD to send a debit card for unemployment after you certified online?
Yes, so sorry about that. I did answer in text, Kelly, but just to answer you over the phone, Bank of America issues out the debit card. So EDD will notify Bank of America when the first payment is issued, and Bank of America will subsequently generate and then mail out the debit card. This standard mailing times do apply, which is quoted as 7 to 10 business days. However, in these unprecedented times, Bank of America has let us know, due to the influx of unemployment claims, disability insurance, and paid family leave, that they're experiencing some delays with that. So you can anticipate that it may take a few days longer than the standard 7 to 10 business days, which is typically up to 2 just standard weeks.
Also a question that I think is important for all of us, can we request caregiver paid family leave afterward? I took time off to care for an ill grandchild, and I'm still doing so. I did not know I qualified for wage replacement since I work less than 20 hours a week. Katie Morales said there is a timely period of 41 days to submit a claim. However, we understand there are circumstances that may have prevented an individual from filing in a timely manner. You may always submit a claim and attach a letter indicating why the claim is untimely. There should be a compelling reason listed if it is a substantial untimely period. Thank you.
Can I ask a question that came out in the questions? And I wanted to just verify that I know that a parent of an adult child who just gave birth could be the caregiver of that adult child. But one question I had for Katie Morales is, if it's an uncomplicated pregnancy, would it still be easy? Let's say I had an adult child who gave birth and I wanted to care for them in the recovery period. Is there anything different if it's not necessarily a complicated pregnancy?
Can you clarify? You're asking if the individual who wants to care for the pregnant individual, is that what the question is?
Yeah, because I know you can take people to appointments, things like that would be covered by paid leave. But if I were the grandparent of the new child, but it's basically the recovery period, and maybe they don't have a lot of complications, but you are recovering from birth, would there be anything different about caring for your adult child after giving birth if it's not a complicated pregnancy? Does that make sense?
Yes, under the California Employment Insurance Code, one of the eligibility criteria for paid family leave is that it needs to be a seriously ill or injured individual that you're caring for. That the doctor has to, their care provider has to provide certification both to the serious nature of the illness or injury, as well as to the need for care. So typically someone who is recovering from a standard, let's say a normal vaginal delivery, they're recovering under the standard 6 weeks and there's no complications, they may not qualify under the category seriously ill or injured. Is it at the doctor's discretion to say that they are unable to care for themselves? So one of the definitions of serious ill or injured is that they require care, and there's specific types of care that are listed. So they require 24-hour care, they require to be placed into an assisted facility, things like that. So in that particular circumstance for a normal pregnancy, that may not be a qualifying claim.
Oh, okay. But then at the same time, if somebody were recovering from pregnancy and they were on their own or other things, I could see a doctor maybe literally sometimes you might need help getting to a doctor's appointment, things like that. So I bet it varies, but what you're saying sounds like it kind of depends on how much care the person needs, which you never know.
Yes, so it would have to qualify under the CUIC's definition, the California Unemployment Insurance Code's definition of seriously ill or injured.
Mhm.
What else is coming up for folks, Katie?
We had a good question here. How can we best reach out to folks with limited education and literacy skills? How can we raise awareness for undocumented communities with very little literacy skills and access to technology? Sophia, did you want to chime in on this one?
Sure. So thank you for that question. And that's actually exactly the population I work with. The California Work and Family Coalition, they know that this is a systematic problem. So one of the things that the coalition does is actually convene a working group called PFL Advocates, or Paid Family Leave Advocates, that to try to make sure that there's sufficient funding and effective strategies for the EDD to share this information and people know their rights. We want to make sure the info gets to all communities, and strategies could include making sure that we provide the outreach in language and also partnering with trusted groups to deliver the message. So for example, if there's a community organization that's particularly trusted in the community, it's really important that that information be delivered by that community group. We also, I know that you shared your question anonymously, but we also encourage you to reach out to us one-on-one after this training so that we can make sure that you're getting this info in the way that's most helpful to share it with your community. Yeah. And then should I answer this question about the sick hours for childcare?
Go for it.
Okay, so there's so many different local, state, and federal laws, but if you're talking about the expanded FMLA because of COVID. So if because of COVID, your child care provider isn't around anymore or the daycare preschool is closed down, then that's 2/3 regular pay.
Thank you. As we finish up, I know folks are having questions. You can type them into the chat or put them into the Q&A, whichever one is easier for you. Just a reminder for continuing education units, CEUs, and SERPs, a special note for you for RNs and IBCLCs. You will receive your CEUs and SERPs by email after filling out the evaluation. After the webinar, participants will receive an evaluation to complete. After they submit the evaluation, a link will be provided immediately. Please click on the link. This will direct you to a form that you must complete in order to receive your certificate. The form will ask you for your name, first and last, and your license number if this applies to you. Please make sure and fill this all out so that you can get access to your continuing education unit. Units, thank you. If you have any questions about the CEUs, please let us know. And also, this is the third and final webinar of this series. We know that we are not done and we are getting ready to do more. We have had conversations about doing more in Spanish and other languages to reach undocumented workers and immigrants. There is still an idea out there that this is a handout, this is not my money, and if I ask for it, then the government has access to my information and knows that I am undocumented. No, we want to make sure and get rid of those ideas and let people know that if you are working, you are contributing to these funds, it is your money. So we want to make sure and get that information out. If there's anything else that you're thinking of that you or your community needs that we were not able to address in these 3 webinars, please let us know in the chat so that we can get the information out there. What else? Manuel Valencia, in your toolkit, is there a way to reassure undocumented employees regarding the paid family leave not affecting their immigration status? particularly with fear generated by public charge rule? If not in the toolkit, could you direct us to a resource to address those fears? I have family. I've been undocumented myself. We understand that the fear is real. And the reason why we also try and work on having these conversations in a naturalized, normal way is that it does help if I'm able to say that I have family who are undocumented and I understand how they work and I understand how they apply for a job. And as Katie shared today, and as we've shared on the other webinars, it is important to apply. Oh, and Sophia also told us today, apply through the paper forms, attach a copy of the W-2, do not put somebody else's social security number on the form. So if we're able to have these honest conversations, people are more likely to apply, more likely to ask questions. It helps. So yes, there's information in the toolkit. And again, this toolkit is not going to be printed right now because we want to hear from you all. What's working, what's not, what's missing. So again, we're hoping to unveil all of it within the next week or so, as soon as we provide the designer our final edits.
Yes.
What else, Jenya?
Katie wanted to make an announcement.
Yeah.
Yeah, so just really quick, thank you all for being here for this series. I did just want to let you know that the coalition is partnering with Breastfeed LA and Legal Aid at Work to do a webinar for CPSP providers on May 14th. The focus is really going to be on what rights people need to know when they are pregnant or new parents, and it's focused for CPSP providers, but it's a great review for anyone on these webinars, and other folks are welcome as well. So just wanted to let everyone know about that.
Thank you all so much. Jenya, closing thoughts?
No, thank you. Well, yes, thank you very much, everybody. I really appreciate all the great work that went into this. And it was just so inspiring to see all the ways that people are out there using this information in their community. It's exactly what we want. It's exactly the model. And even what Katie from the EDD referenced in her presentation, that we really need trusted messengers. And, you know, the coalition really wants to help make this happen, but we absolutely need to partner with all of you to really spread this information so people know both what they have now, and we also get some good ideas about what we need next. Thank you very much, Alejandra, and everybody for leading this. It's really great.
Thank you. Thank you all. Yes, you will all get a link. So after this, you should be receiving an email from the Work and Family Coalition on filling out the evaluation. You're also going to get access to our upcoming events. Also the May 14th event. You'll get access to everything. So we look forward to seeing you in our next trainings. For those who are going to join the Spanish one, we will be starting at 1 p.m. So we're going to take a little break and then we'll be back at 1 in Spanish. So thank you all so much. Have a wonderful rest of the week. Stay safe and healthy. Wishing the utmost health to all of your communities. Thank you.
Bye.